Hi, it's Dr. Povanka. Hopefully everybody's having a good week. I want to talk a little bit about feline upper respiratory infections in cats. It's something that we see a lot. A lot of times people come in saying, hey, I think my cat has a cold, or I'm not sure quite what's going on. There's lots of sneezing. Sometimes we have weepy eyes. And this typically is due to 3 different viruses. There are other viruses that can cause it, but the 3 that we see most commonly are the herpes virus, which is a different one from the one that we talk about with humans. There's also the calicivirus, and then a little bit less common, there is the chlamydia virus that we see with cats. Again, kind of different from the one we see with humans. Now, the herpes virus and the calicivirus are the 2 most common causes that we see with our cats, and we kind of see different patterns with these. Typically, the herpes viral will see more eye stuff. My cat who used to have a herpes viral infection, he would just have one eye that was squinty because he was older and his immune system had kicked in. He didn't have as much issue with it at that point. Calicivirus, usually I'll see oral ulcerations, and you can see way more severe things with that. There are some pretty fatal infections they can get with that. Those are pretty rare. And then there's a lameness that sometimes people see. I can't say I've ever seen a lameness or that fatal form. What I have seen is a lot of eye problems, a lot of ulcerations on the mouth, and a lot of stuffy noses. So typically this is something that we see in kittens first, and the analogy I always like to use is chickenpox versus the shingles. So as a kid, most of us get chickenpox. It's a virus, so it stays latent in our system. And when we're stressed and the immune system is a little bit weakened, we'll see that come back as shingles. And it's very similar with this feline upper respiratory virus. When we're stressed out, if there's surgery, boarding, new pets in the house, things like that, we'll get that congestion back, sometimes the weepy eyes, and sometimes with the calicivirus, the ulcerations in the mouth. With this, if you do have a cat who has any of these signs, we do recommend testing them for feline immunovirus or for feline leukemia, because those can really take a toll on the immune system. Most cats, when they get this feline upper respiratory viral infection, their immune system will kick in, and as long as they're not a kitten that doesn't have a developed immune system yet, they typically don't have very many clinical signs. You'll see like a little bit of stuffiness or a little weepy eye. The cats that seem like they have a hard time getting over it typically have something secondary going on, such as that feline leukemia, feline immunovirus, but something's not quite right with their immune system, that it's weakened and they're continuing to get affected. With that, you could also see chronic stress causing that too, because that does weaken the immune system also. With this, kind of similar to the chickenpox analogy again, most cats have exposure and they do have this virus in their system. And typically when they first come in, they first have it, we have that clear nasal discharge or clear ocular discharge. And at that point, I was always taught that it's a viral infection. And once we start getting the goopy, more opaque, like green, yellow, white discharge, that's when we have that secondary bacterial infection. So bacteria can be opportunistic, meaning if there's already a weakness, they're going to come in and take advantage. So that's when we will pull out the antibiotics and go there as far as making sure that we're supporting the pet correctly with our treatment. Now that's kind of the general facts about feline upper respiratory infections. And I would say that is something that I would recommend talking to your vet more about as far as treatment. A lot of the treatment is kind of based on some human medicine things, and as far as like some antiviral or supportive care, but it is something you can talk more about with your vet. But there are some cool options. Again, that stress is definitely a trigger, so make sure that you have good stress control and that we're not increasing the stress for your pets. Let me know if you have any questions or if there's anything you want me to cover. Thanks.